A D-dimer test is a blood test that looks for the presence of D-dimers in your blood. So what is D-dimer? D-dimer is a protein fragment that is found in your blood in an elevated level when a blood clot dissolves in your body. What happens when there is a cut and you bleed? When a body part is damaged or bleeds from somewhere, the body tries to stop the bleeding by clumping together the cells there to make a network of several proteins forming a blood clot. Once the bleeding stops, you don't need the clot anymore, so your body takes a series of steps and starts to break the clot. At the end of all that, you have some fragments of protein floating around in your blood, called the fibrin degradation products or FDPs. One of these fragments is called D-dimers. In normal conditions such as during a cut or a damaged tissue, there is no elevated D-dimers in the blood. Normally, with a little time, about approximately 8 hours, the D-dimer goes away from your bloodstream. Elevated levels are only observed during pathological and non-pathological conditions. You can get high levels of D-dimer in your blood if you have a major clot, as in case of blood clotting disorders like deep vein thrombosis or DVT, a blood clot deep inside your vein, or pulmonary embolism or PE, a blockage in the artery in the lungs. D-dimer levels can be higher in people with other conditions like pregnancy, cancer, liver disease, trauma and injury, surgery, stroke, and even inflammation and sepsis. Recent studies have shown elevated levels of D-dimer in COVID-19 patients. Rare symptoms like blood clotting are also being seen in COVID-19 patients. Researchers have found that the elevated level of D-dimer is associated with the disease progression of COVID-19. Or in other words, D-dimer might be a manifestation of severe virus infection resulting in sepsis and coagulation in the lungs due to blood clot followed by degradation of the clot. However, the association between D-dimer and the severity of COVID-19 is not clear yet. So D-dimer test shows the presence of blood clots even in lungs and helps doctors to draw more attention to patients having severe breathing trouble in early time. The references are given in the description. The cutoff value for D-dimer is 500 nanogram per ml. Anything above 500 nanogram per ml is considered abnormal or elevated and should be addressed immediately. The negative value of D-dimer can rule out conditions like deep vein thrombosis and pulmonary embolism, and the positive value needs immediate further investigations. D-dimer testing is very cost-effective, requires a simple blood draw and provides results in few minutes. Hope this was helpful and thanks for watching.